Celebrity Smile is brought to you by Dr. Terry Alani. Whitney, whose pearly whites are these?
Oh, Kate Hudson's, and I bet she has good breath. All right, everybody, welcome back. Okay, so we just talked about bad teeth, and no one likes a busted grill, but also no one likes a potty mouth. So now we're discussing how to break it to your man to clean up his act, starting with his bad breath. So please welcome back Dr. Terry Alani, along with Joyce, Amanda, and Sharon, our women's panel, to talk about bad breath. Okay, so in the break, we talked a little bit about, the obvious factors, garlic and onions. Okay, clearly all of us will get bad breath from that. But Dr. Alani said that you really get most of your bad breath comes from
the back of the mouth. Your bacteria is in the back of the mouth. There's 170 bacteria in
joy.
the back of your mouth. And basically that's where most bacteria comes from. So what do you do with your significant other if he has bad breath? Buy him a tongue cleaner, a tongue scraper. You can scrape the tongue. Get him to go to the dentist twice a year, flossing. You want to I always say, if you take a shower, you clean between your toes. If you brush your teeth, you have to floss between your teeth. Get the stuff out between your teeth. It's nasty. Flossing, there's mouth rinses. If you're going to get a mouth rinse, you can lay out a mouth rinse in the bathroom. Make sure it's got zinc and chlorine dioxide.
And you said make sure it doesn't have alcohol.
Alcohol dries the mouth out. Sugar-free gum, mints. If you're out to dinner, have them eat some parsley and say, hey, taste this, see what you think. The parsley is actually good. It gets rid of that odor, and lemon.
And then hopefully he's not your date that picks his teeth after with the parsley, right? And you know what, I like the lemon thing. She said, actually, like if you don't want to suck a lemon, throw it in your bag, go to the bathroom, go into the stall, suck the lemon. It apparently kills.
Mints. I mean, there's so many ways. Buy him an electric toothbrush, and a lot of times just call his mom and ask him, what can I do to help?
See, that's assuming that you know them already.
Right.
I mean, that's a lot. Some people you just meet and they have bad breath, and so you gotta hint or something. You offer some gum or some mints or something, or even just waking up in the morning.
Or just be like a weapon. Amanda has a Listerine weapon.
Have some of this, and why don't you also?
Exactly. Exactly. And then if they say, why do you think I need it? You just say, well, sometimes we all...
Who would ask? Why would they ask?
They do. Some people do. They're like, do I need that?
In conversation, though, you can also tell them, if you just met them, that you can talk about deal breakers or your pet peeve, and you can say, one of my pet peeves, there are people that have bad breath.
That's smart. That's smart.
But some people don't really realize that they have bad breath, and they're all in your face trying to be sexy, really trying to have a conversation.
And you're like,
you're just like, yeah.
Do you think that when they offer you a piece of gum, do you think they think your breath smells bad?
I think girls immediately think that. Women immediately think that. They go, oh, do I? But
we're a lot more concerned about it.
We did. There was that test.
The test. Oh, the test.
You lick the back of your hand, and then you wait a few minutes and smell it.
I know it's gross, but if you really want to know, it's a good idea. It works.
But wouldn't it be nasty after a few minutes anyway? If you lick the back of your hand, I mean, is that a real test?
Yes, it is.
Oh, so if it stings, you stink.
Sugar-free gum. I choose sugar-free gum all the time because it stimulates the saliva. Because dry mouth causes bad breath.
So the dry mouth, if you're dehydrated or you haven't, that's why when you wake up in the morning, you told me you
drink
have bad
lots
breath.
of water, and then of course smoking. There's nothing good about smoking.
Now let's talk about this trench mouth. Is that it's just such a bizarre?
Trench mouth is gum disease, but it's a very severe form of gum disease. It's more of an infection, and it usually occurs more in males under 35 years of age.
Oh,
so that probably would not be our age group.
I'm a single guy.
Fantastic. That's why they all stink.
But it's gum disease, and you need to talk that person into going to see us. We do a thorough cleaning. A lot of times, after the patient comes in and has a thorough cleaning done, and we floss, we get them on a program.
That's the only time to kiss
clean.
them?
Afterwards, that's when you kiss. Squeaky clean. That's exactly right.
Okay, now what about sores? Because this can get kind of serious, and you have to kind of focus on this.
Okay, there's two different types. There's the aphthous ulcers or the canker sores that are actually inside the mouth, the back of the throat, the tongue, the cheek, that sometimes they really hurt.
Are those
contagious? Are viral in nature. They are not contagious. And they don't know the etiology or what causes them. They don't really know. There's not a cure, but there's topical steroids if they get very severe, or your dentist can give you a rinse of half baking soda, half salt, or hydrogen peroxide and water. But then there's the other form of ulcers that you see, the herpes lesions
That's what I was
on
gonna
the
say.
mouth.
Isn't that herpes?
everybody went down.
That is herpes
Yeah.
simplex virus. A lot of times it's just your genetic makeup that brings them out. They come in times of stress, your time of the month, what have you. But they are contagious. So you just have to be real careful. And there's medicines that we prescribe. One of them is Zovirax or Valtrex. You take 1 or 2 pills right in the onset, and it's gone. So you'll never have it. But that's a whole different form.
Those are different than the other kind, right?
Now, which other kind?
That's the kind of
You know, the other kind of herpes.
virus.
Actually, yes. But you know, there's the HPV virus. The HPV virus, which they now have vaccines for in young girls, and I would advise every person with a teenage child to have their child vaccinated. But what they're finding out is there are more men now. There's a rise of oral cancer in men because
Why?
of HPV, because of oral sex.
Oh, wow.
And you will be reading about it. So now they're trying to develop a vaccine for men.
For the HPV.
For HPV.
Well, they've been testing.
And you heard it here first,
Wow.
but it is out there.
That is
We
amazing.
didn't have enough to worry about.
Yes, yes.
You know.
Well, thank goodness that if they have bad teeth and bad breath, it's just a non-starter to begin with, right? Right. I know. I want to thank our panel. Of course, they were great. And then, of course, Dr. Lotte, you can get a hold of her. She's my dentist. She's all of our dentists, actually. She's amazing. 713-621-5141. And by the way, she's also really good at relationships. So anytime you just want to throw a few things out there, she's got you covered. Plus, she has to talk the whole time, and you can't. So give her a call, everybody. Stick with us, though. We'll be right back.